Hello boys and girls, it's been a while since my last vid, so some of you have been asking me to do a new vid. It's been 7.5 months now since my second hair transplant and it's going really well. The crown was done mostly on the second one, so I had 3,400 grafts and about 2,900 of those were placed into the crown. Also I had about 500 just to top up the front a little. So it's been going really well. It's really surprised me actually just how much it has grown just recently. The crown has just really thickened, and even under some pretty bright lights like at the gym and stuff like that, you can look at in the mirror and I'm really impressed with how it's going. So as you can see, since the last vid I've cut it on top. I've done grade 5, a short grade 5 on top and grade 1 on the sides and back, but I've been doing it for I did it a few weeks back, so it's sort of probably grown a little bit since then. It's a bit messy today because I haven't sort of done anything with it. It's sticking up a bit, but yeah, it's really good. I'm really impressed with it. Let's just try and get a close look. Some of you like me to try and sort of move my head around like that, and some like me to put the camera over the top. It's obviously hard for me to see how it's focusing, but yeah, it's really come on well. I'm in front of a really bright window at the moment, so let's hope you can see alright. It's quite a big sort of grade difference from 1, which is at the bottom, to 5 on top, so it's kind of quite a big difference, but no, I'm really pleased with it. It's coming along really well. As you can see, the hairline I'm really pleased with. It looks natural for someone of my age, and like I say all the time, if you're happy with it, don't worry if anyone else isn't. It's up to them, but I'm really pleased with it myself. I don't like to cut it too short on top, as I've said before, because it will look slightly less dense. You'll see your natural sort of hair where it's not quite as dense as areas that haven't balded at all. So that, if you remember, I had the first dot was 3,300 grafts, which was mostly the front, and some in the middle and a few in the crown, but the second dot was concentrating on the crown with a few topping up at the front. So yeah, it's been going really well. One thing I thought I'd talk about is a lot of you ask me the same questions, and so I thought I'd do my top 3 questions that I get asked regarding hair. I'm trying to make my vids a little bit smaller, the hair ones, because I do talk quite a lot. The first question I get asked all the time is, where did you get your hair transplants done? Was it the same place? Yes, I got them both done at Dr Cinik in Turkey, Istanbul in Turkey. The first one I stayed there 2 nights, the second one I stayed there 3 nights. So it was great. The new clinics, brilliant, really happy with my first op, so went back for a second. And it's a bit nervous, it's only natural to be nervous, but it's gone really well, so I'm pleased I went back for the second now, because it really has. I didn't think my crown would get quite as dense as what it was, but they've done a really good job, and it's really put my mind at ease, because after the first one where it was more the front, the crown sort of under certain lights, I could get away with it by brushing the hair across and stuff like that. Second question I get asked all the time is, what shampoo do you use? All the time. Literally I get asked this so many times every week. As far as I'm concerned, shampoo is just for washing your hair. I don't think it makes your hair grow that much. Some would disagree with me, but if that was the case, we wouldn't be having hair transplants, we'd be just buying loads of shampoo. So I use the one that the clinic gave me when you have your op. I use that until it's finished, and I don't wash my hair about 3 or 4 times a week, so one bottle lasts me quite a long time, because my hair's short, so I don't have to use tons of shampoo. When I finish using that, just use this good old Tesco's extracts Comes in a few different flavours. This one's raspberry. I don't know if flavour is the right word actually. For all hair types, it's about 90p. You know, I don't like spending loads on shampoo because it washes your hair. Some smell slightly different than others, some lather up more than others. But, you know, I was spending £10 on some shampoos, and to me they do nothing any different, apart from smell slightly different, or they soap up, lather up more. But apart from that, I just keep with the cheapest ones now because I don't consider that it's worth spending loads on shampoo. The next question I get asked loads is, I've answered this one a few times as well, it's when you have your donor, which is the sides and the back, or sometimes they take from under the beard, when that hair's removed, the grafts, does it regrow back? No, because it's taken out, it's put in to make your other areas look less bald. So people think, well, hang on a minute, you're taking all this hair out, you know, aren't you going to be bald on the sides and the back? No, this is where it's important. You go to somewhere that knows what they're doing. The reason it looks like you've still got hair, and you know, I'm really pleased with my donor areas because it looks absolutely perfect. The reason they do this is they're very skilled. They take a hair and then they sort of leave one, take one, leave one, so it still gives the impression that you've got nice donor area hair. And we don't want to be over harvested because that's when they take too many hairs from the, sorry, grafts I should say, and that is when it ends up, you might get bald spots and things like that. It's not to be confused with like shedding. When you first have your op, some of the other hair just sort of sheds, and the hair you've had put in sort of sometimes falls back out, or you get shock loss on the sides. But once you know that grows back, that's just something different. That's where you're shedding when you've had the op, but then it will regrow because your grafts are in there, so you've had the roots put in with the hairs, so to speak. So your donor area though, where they've taken the hair out, no, that doesn't grow back. So that's why you can't have like 100 hair transplants, because you'd run out of hair to transplant. In the future, maybe they're coming up with things where they can grow hair and things like that. And you know, in the future, I don't know how far in future, they will come up with ways, I guess, of doing it so that you could have stem cells and multiple hair transplants, or maybe you might even just need one. They might get it so that you can have so many hairs, and in one go you'd just be able to have the whole thing. But they're the three main questions I get asked. Where did I go for my ops? The shampoo, what do I use? And the one about the donor hairs. Some people are really shocked that once you've taken a graft that it's not going to suddenly grow back in the same place because you know you've taken it out. So they're the three main questions. If you've got any other questions, feel free to ask. Put them down below in the comments section, or put them onto Instagram. I've got my Instagram page. At the bottom of this video I'll leave a page just above the comments. I'll put a link to my Facebook group, which, you know, we've got over 3,500 members now. It's doing really well, and you know, we like to show photos of our hair, our teeth, everything, because we also talk about dental and health in general. So it's a friendly group. We only let you sort of review clinics you've actually been to, so that we don't get my mates, brothers, sisters, dogs, cat went here, and you know, like you get with some groups where it's just all hearsay. We only talk about places we've actually been to. That way you get a more honest review. We talk about both good and bad, and you know, it's a friendly group. People are not frightened to ask things. No question's too small, because we all have to learn somewhere. So it's been going well. The whole group's very friendly, and we're trying to make sure we keep it that way. That's about it really. 7.5 months after the second one. Had the first one December 2018. It's now December 2022. So yeah, 4 years since my first one, and 7.5 months since the second op. At the moment I've got like, you can see it, there's a bit of metal in my tooth. Had a tooth pulled out and I'm having an implant put in. It's been going on for quite a while now. I was sort of paying a bit at a time. Had the implant, the first part put in, the sort of screw part that goes in. The gum started regrowing over the top, so they put in a bigger screw now. So it's all been going well. There's no pain from that at all. The hardest part was probably taking the old broken tooth out. They want me to go in on Monday, and the lab has built my new tooth that's going to go in, so that's going to be put in. It has a screw that goes up through the middle. They screw it in, and then a sort of cap on top, like put a sort of white filling to cover it. So hopefully next time you see me I will have like nice teeth and no gap there with a metal sort of screw in there. Yeah, apart from that, all good. My hair at the moment, some people like it long, some like it short. I did go a little bit short with it because like I don't cut it for 6 months after I have my hair up, apart from the sides and back I do cut. So I thought I'd leave it for the 6 months, and then I thought I'll give it a cut, so I did go quite short. It was a short grade 5. Probably go for a grade 8 in future. I don't like too short, like I said, because if I go really short, I don't mind it on the sides and back short, but on the top you'll kind of see like the areas where it's used to be bald, and it's not as dense as the natural bits that have not balded, the side bits there. But no, I'm really chuffed. Like I said, I'm in front of a really bright window now. Sides and back are fine, the donor areas, and the crown is just flourished. It's just literally sprung to life. It was kind of, it grows slowly for the first 6 months, and then after that it seemed to just flourish and really bloom. So hopefully it's all going to stay in. I'm taking the same natural pills. Can't take finasteride still because I'm still donating blood. So hopefully I'm at the age now, coming up to 48 in March next year, where I'm not losing any excessive hair now. So hopefully I'm just lucky, really. I've been pretty lucky in the fact I've not shed any hair when I've had both ops. Any questions though, leave a comment below, or go onto the new Facebook group and leave comments and questions on there. There's loads of people that can answer you on there as well. Do try and answer as many comments as I can, but I'm really busy as always. If you like travelling, check out my other vids. I've got loads of hotels I've been staying in, and I've been sort of making vids of those more to remind myself exactly what hotels I've been in and what they're like. I'm lucky in some ways. I do get to stay in a lot of places. I travel a lot, so it's good for me to remember. But hope you have a great Christmas if I don't speak to you before. Good luck with your hair transplants. I know quite a few of you have been going just recently. One of our admins on the group has just had his second op, so it's going to be interesting to see his hair. Cheers, bye.